Hi, everyone. My name is Jeremy, and I'm a representative of EHN Canada. We are a nationwide network of treatment centers for addiction, trauma, and mental health. We have facilities located in Nanaimo, British Columbia, Calgary, Alberta, Toronto and Peterborough, Ontario, Montreal, Quebec, and Annapolis County, Nova Scotia. We offer high-quality inpatient, outpatient, and online treatment programs. For more information, please visit our website at ehncanada.com. Just a little bit of housekeeping for everyone. We are all on mute and cameras are off for today's webinar, but please feel free to use the Q&A box at the bottom of the screen to submit your questions for our speaker. We will try to get to as many as possible at the end of today's session. Today's webinar is being recorded, and we will be sending out a follow-up email next week, sometime mid to late next week, that will include the link to the video, the slides, and any other useful resources mentioned today, as well as your CEU certificate. Again, the email will be sent out sometime mid to late next week. I and Rochelle are located in Toronto. Toronto is located on the traditional territory of several nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. It is covered by Treaty 13 with the Mississauga of the Credit. If you are new to this work and want to find out whose land you are on or grew up on, please check out www.native-land.ca. Many more of you may be physically present elsewhere. I encourage everyone to use the chat function to, where applicable, share whose land you are on. Now, to get to today's session, innovation through intensive outpatient programming. We have Rochelle Hildebrand. Rochelle is the Interim Executive Director for EHN Outpatient Services. She holds an undergraduate degree from Carleton and a master's degree from the University of Arts, London. As the Director of Operations and now Interim Executive Director, Rochelle manages all day-to-day operations of 6 outpatient clinics, in addition to providing leadership and strategic planning for all areas of EHN Outpatient Services. Rochelle has been leading the move to virtual care at EHN since 2015 with the creation of the Wagon app. Since then, Wagon has expanded in EHN Online, providing efficient and effective digital care for substance use, mood, and anxiety, trauma, and more to more than 2,000 clients in less than 2 years. Rochelle is most proud of seamless transition for 5 in-person clinics to online care without any disruption in programming at the outset of COVID-19. Please help me welcome Rochelle.
Thanks, Jeremy. I'm excited to be here today to talk to you guys a little bit about how we provide online care, intensive online care in the online setting for clients who are particularly high needs. So let's get into a little bit. Today, what I'm going to go over is just a quick review of our current state of mental health and addiction, and talk a little bit about mental health and addiction as chronic conditions that often show up in our workplaces. We're going to go over what our intensive outpatient programs are and what effective online programs look like. We're going to talk a little bit about the research around online treatment, as well as the research around group therapy and why we choose group as a big part of our programs. And then we'll take some time to go over our particular platform, how it works, and look at some of the outcomes for our particular programs. Okay, so it's not news to anybody here. Everybody here knows that COVID-19 and the pandemic have had a really, really big effect on mental health, and that, there's been a lot of conversation and a lot of attention, on mental health as the COVID-19 pandemic has progressed. And I think one of the big, messages that I would like to send or get out there is that even though we are sort of returning to some form of normal, things are opening back up again, restrictions are lifting, vaccines are out, that doesn't change the mental health side effects. Those will continue to affect people for probably a few years to come is the prediction. And so you may have heard the term of sort of the shadow pandemic for mental health. And we are still right in the middle of that shadow pandemic where, mental health rates and incidences and severity of symptoms are up and on the rise. So what does that look like? I'm sure this is review for a lot of you guys, so I'm not going to spend too much time on it. But what we are seeing are increased cases of substance use disorders, relapses, and drug and alcohol related deaths, right? So we know that substance use is on the rise, and you see down here that also includes increased rates of binge drinking. So if maybe for those who haven't been diagnosed with substance use disorders or who don't suffer from a substance use disorder, there is also a rise in incidence of binge drinking. We continue to see increased rates of stress, anxiety, and depression. Many people, that is continuing for them as things do reopen and as they feel unsure and they feel anxious about the reopening process, as well as just processing all that's happened in the last couple of years. We continue to see increased cases of trauma that's been acquired in the workplace. And, again, while we may be going out to restaurants and starting to re-engage in some of those activities, there is still very much an increased workload in hospitals and for first responders. And so we expect that those cases of trauma that are acquired in the workplace will continue for a little while to come. We know that those with pre-existing conditions are still at risk of severe impacts on their mental health, or they've already had those impacts and are seeing an increased severity in their pre-existing mental health condition. We know that, interestingly enough, women are experiencing higher rates than normal of depression and loneliness. And we know that many people are still working from home. Many people's work conditions, life conditions, family conditions are permanently changed and permanently affected from the COVID-19 pandemic. And so we know that there were increased rates of loneliness and isolation over the pandemic, and those effects are still being felt today. Maybe maybe we're a bit more used to it. Maybe we're quite adjusted to working from home or to being more isolated from family and friends. But that doesn't mean that it stops affecting mental health, right? So this is all kind of that shadow pandemic that just starting to reopen doesn't immediately solve or remove the side effects, the mental health side effects that we see from the pandemic. So I think that's the big takeaway, for the effects of COVID-19 is that it's really continuing and is likely to continue for a little while. One of the things, just to sort of set the stage when we're talking about increased rates of mental health and symptom changes and increased severity, one of the things that's really important to think about and to understand is that there are, different levels of severity within mental health and mental health conditions. And so, for example, if we look at somebody who has a mild mental health condition, that person is probably still functioning at work. They're probably still functioning in their personal life, right? They're able to manage their responsibilities and their tasks and their family life in a way that is normal for them. Their mental health symptoms are probably triggered by some kind of event or situation. So there could be a particularly stressful time at work or in their family, and that could bring on the onset of some mental health symptoms. When it comes to services, somebody with mild symptoms maybe is accessing support for the first time, and maybe they've gotten a little bit of support before, but they've had that trigger come up again, and they're going to access some services. And the kind of services that are really wonderful options, and there are many options for people with mild symptoms, out there. These include individual counseling, right? I think what we normally think of as therapy is accessing a therapist once or twice a month or once a week, and working through some of the things that are coming up. The other thing that we see a lot, and there's been a real explosion in offerings throughout the pandemic, is ICBT, which is a great tool for people with mild mental health symptoms. Self-guided therapy. So this is kind of similar to ICBT, but things where they can do workbooks or work through things online, and use some of the therapeutic tools, but do it on their own, right? This is also where we see wellness apps like, meditation or mindfulness, and peer support groups. So all of these options, as you see, there's quite a few of them, are available for mild symptoms, and they are a really, really effective intervention for people with that mild mental health condition. On the other end of the spectrum, on the other side, of course, is severe. And so what we see with somebody who is severe is we're often now looking at somebody with very low functioning, or not functioning at all. So that might mean they're no longer at work. Maybe they've taken a leave of absence from work, or if they are at work, you're seeing, real issues in their managing at work, difficulties within their family life, difficulties keeping up all of those regular responsibilities, or maybe not doing it all at this point. When it comes to, that intensity, somebody with severe symptoms is likely to have a chronic mental health condition. Not everybody, that's not always true, but this now could be a chronic mental health condition that somebody will be managing on and off for a long period of time. Often, those with severe symptoms have already accessed a lot of different types of mental health supports before and have not seen the improvement that they need to see to really start to get better, to improve that functioning. And these are, clients who really often require something quite intense, like a residential treatment program or a partial hospitalization program, a PHP. And the interesting thing is that when we look at mild and severe, there are lots of really great options for treatment out there for people who are in that mild or that severe category, right? Really thoughtful, smart programs that are evidence-based, that are really serving clients with those needs. What we don't see as much in Canada is that middle category, the moderate category. And our programs really serve our online intensive outpatient programs really serve that moderate client. And so that's why I kind of want to set the stage for you here today. So when we look at a moderate client, we're looking at somebody who is maybe starting to see some disrupted functioning, right? So maybe they are they're taking more sick days. Maybe they're at work, but they're really not able to effectively manage all of their roles and responsibilities. Same thing with their personal life. They're still trying to engage, they're still trying to do their best, but are really having trouble managing all of the things that they need to do because of their mental health. They're starting to have more frequent and intense mental health episodes. So it may not be chronic yet, but it's now not just triggered by that one situation, that stressful situation, right? It's starting to become more frequent and more intense. Oftentimes, a client with a moderate mental health disorder has accessed individual counseling before. Maybe they've tried some of the digital solutions like ICBT or self-guided therapy, but it just hasn't been enough for them. They're not making the improvements that they need to make. And that's where a combination of individual and group therapy is recommended. This is where our programs come in, the Intensive Outpatient or IOP. And so, to tie it back to the pandemic, when we say because of COVID-19 that severity, mental health severity is increasing, what we're seeing is that a client who was potentially mild before the pandemic may now be moderate. And now that we're 2 years in, if they didn't get any help during that moderate phase, maybe is also now 2 years later in the severe category. So what we're seeing is that, people who maybe started off as mild before the pandemic may now be moderate. Somebody who was moderate before the pandemic may now be severe. And so that's that increasing of symptom severity. And, really matching clients or employees with the appropriate level of mental health care is really going to give the best chance of success. And so, like I mentioned, there's lots of options out there for severe, lots of options out there for mild. What we're really missing, and what we're providing, is options for those people in the moderate category. And I just want to mention, I'm sure there are some of you attending this webinar, and again, you probably know these things, but there are definitely some both direct and indirect costs to employers to this increase in mental health severity, right? We know some of the direct costs come in our benefits packages, right? Our healthcare costs, our psychological care costs, how much we're spending, in getting different mental health drugs. It could be things like income support or, short and long-term disability claims. Those are those direct costs that we know about. And of course, we also have the indirect costs. We have absenteeism, right? People needing to take time off due to their mental health. We have that presenteeism, attending work and really not being able to be as productive as they would be if they were sort of functioning at their best, right? And I think the other thing is employee turnover, which we all know is difficult and costly when we have a high employee turnover due to mental health symptoms. Okay, so let's talk a little bit about our intensive outpatient programs. So you're going to hear me say IOP a lot. I'm going to try and say intensive outpatient program just because we always tend to use acronyms that are maybe only familiar to ourselves. And so I don't want to confuse anybody. But you may or may not know that intensive outpatient programs are a very common treatment intervention in the States, less so here in Canada, but it's a very, very evidence-based and well-researched treatment approach that is used very frequently in the States. And it's used in two ways in the States. One, to treat those moderate clients that we're talking about, right? Clients who are in that middle ground of severity. And two, as a way for clients who are in the severe category who do go to a residential or a day program to then step down into the next level of care to really support them in that long-term recovery. So what does an intensive outpatient program look like? Well, the program that we offer is a one-year program, and it consists of two parts. We do 8 weeks of that intensive therapy, and then we have an aftercare portion. So when we look at the 8 weeks, what we're looking at is 8 hours of psychoeducational or skills groups each and every week for 8 weeks. And I'm going to go into I'll go a little bit into why we use group therapy and why it's such an effective intervention. But what's happening is that for 8 hours a week, in the evenings or in the daytime, depending on if they're at work or not, clients are joining a group of their peers who are dealing with the same thing to learn skills and use evidence-based approaches in those groups. Each week in that intensive phase, they're also going to get 1 hour of individual therapy per week. So this is a chance for them to get some of that personalized care, some of that customized approach, and to really talk about some of their particular issues and how they're going to implement the skills. We also offer 12 hours of family programming. So this is programming for any loved one who's going to be supporting that individual. And that really can be anyone. That can be a roommate, that can be a friend, that can be a partner, a spouse, a parent, whoever is going to be one of this individual's support system is welcome in our family programming. And the idea is to provide families with an understanding of the mental health disorder that the client is receiving treatment for and how to support them, right? And this we know that clients who have a family environment, a supportive environment where everybody's kind of speaking the same language, those clients are going to do a little bit better. And so it's really important to us to be able to provide that programming for the loved ones. They're also going to have access, of course, to our Wagon platform and our app, which I'll go a little bit more into as we talk about how we facilitate this kind of intensive program online. But they have access to that for the full year that they're with us. And when we look at the aftercare portion, after the 8 weeks of intensive therapy, what they're going to do is they're going to step down into 2 hours a week of supportive group therapy. And they're going to have access to that for 10 months. And this is where they're really going to learn and discuss and connect with their peers on how they're implementing all of the different skills and psychoeducation that we taught them in those 8 weeks of therapy. So it's really to help them put those skills and those practices into place. Our programs use evidence-based approaches, so this is really important. So the types of therapeutic interventions that we're using in our program are typically CBT, DBT, behavioral activation, and ACT, which is acceptance and commitment therapy. All of these approaches are well-researched and proven to support clients with the specific disorders that we're treating. And we use a different mix of them based on which program the client is in and which interventions are more effective for specific disorders. So what are the benefits of an IOP for clients or for employees, depending on how you're thinking about this? I think the first thing that we like, or the first thing to say is that we have separate streams for different disorders. So we have one for substance use, one for mood and anxiety, and one for trauma, specifically workplace trauma. And each of those streams mixes those different therapeutic approaches in the way that's going to be most beneficial for that particular disorder. And so clients are, put into the groups with only other substance use clients, and they're really focused on that substance use in that stream. Same with mood and anxiety, same with workplace trauma. As I mentioned, the program is very skills-based. So we're really looking at giving the clients the tools they need to be able to cope with their mental health disorder and really focusing on that increasing productivity, right? Helping them improve that function so they're able to manage the tasks of their day-to-day life, including their work. We do, and I'm going to talk about this a little bit more, but one of the benefits for the clients or the employee is that they get outcome measurement. And so as they're moving throughout the programming, we're using standardized tools to track their progress and then using those to support and inform our long-term recommendations. So what are they going to need next? Well, let's base that on evidence and data. What is going to be the next best treatment option for them? Of course, it's online, which is both accessible and convenient, and of course, not pandemic proof, we like to say. And clients are going to get regular progress reports. They're going to get post-treatment recommendations, and they're going to go into that aftercare phase. So they're really going to get the long-term support that they need to see that symptom reduction. And what about for employers? I think one of the things that we're starting to see, and I'm sure a lot of you are seeing this in your own work, that employers are really recognizing the value of supporting employees with mental health disorders and getting them the support that they need. And so when we think about an employer who's looking at a benefits package or figuring out what kind of support can they provide to their employees, an IOP can be a really beneficial complement to your mental health strategy. As I've said a couple of times, the programs are really designed to reduce symptoms, right? And those are the symptoms that do interfere with work life. Like I said, the separate streams for substance use disorders, mood and anxiety, right? All of those things are really helpful for an employer. But I think, one of the big things is that it's really about maximizing that return on investment and investing in programs that are going to decrease disability costs and ultimately keep employees well, right? And that is really the goal, is to keep them well, to keep them healthy, so that they're able to be engaged not only in work but in their personal lives, and able to have that functioning and that productivity that they want to have. Also, we are including, of course, regular progress reports and discharge summaries, again, that are going to talk about recommendations for post-treatment. What might a client need to continue their success, to continue getting better, as well as, easy access to treatment. I think one of the nice things about an intensive outpatient program is that a client who is moderate, who is still at work, can engage in this intensive treatment while continuing to work or continuing to manage their home life. And they can do it relatively quickly and can stay at home and get the support that they need. Okay, so let's talk a little bit about the efficacy of online treatment. I think definitely there's been lots of questions about this in the last couple of years, especially as many providers had to move to online treatment very quickly and without a lot of time to prepare. And the question is online treatment effective? I think that's a question we certainly got in a lot in the beginning of the pandemic. We get it less so now because I think we're seeing clients get better. We're seeing clients do well in online programming. But I think the assumption going into the pandemic was that online was a good option for those who couldn't access in person, because in person, was just going to be more effective. And what we would say is that some of the evidence really actually contradicts that. So, for example, there are a couple of studies here that we've kind of pulled out the conclusions from. One of them saying that multimodal digital psychotherapy, which is what we're talking about here, individual, group, and app-based interventions, using those multimodal interventions are effective treatment for adult depression. The evidence here shows that ICBT and face-to-face treatment produced equivalent overall effects for mood and anxiety disorders. For those, I think as long as you're giving people the right level of care, ICBT and face-to-face treatment can have the same outcomes for clients. We see that ICBT is as effective as conventional CBT. And, here's one here from the Yale University School of Medicine that showed, after the initiation of online treatment services, hospitalization episodes decreased by approximately 25%. So what we know is that online treatment can be very effective interventions for clients who need the support. And there's lots of benefits. I don't want to, again, you guys we're 2 years in, a lot of this stuff, but I think one of the questions that we often get is like, okay, now that, the pandemic things are opening up. I don't want to say the pandemic's over because I don't think that that's true, but now that things are opening up, are you going to switch everything back to in-person care? And I think, the answer for us is we will offer some in-person care, but we will not switch everything back to in-person, because there are just so many benefits to online treatment for both clients and for everyone who's engaging. So, of course, services remain interrupted regardless of the public health situation. I think that's really important, especially as we've seen COVID cases rise and fall and restrictions come and go. The clients who are in online care see no disruption of service, which is really important. Of course, it's not just all about COVID. There are lots of clients or employees who live in remote communities where there just are not a lot of mental health options. These are communities that are underserved in terms of what kind of supports they have for mental health. And so, that's something that is not at all to do with COVID. And those are employees or clients who really deserve a quality care and in getting it in their community if they can. It's very accommodating for schedules, for time zones, for people's work and life schedules, and balancing childcare and balancing, all of the different things that we have in our lives. And, you can really support people in all of these different time zones and with all these different schedules, which is nice. This one is really big, and it reduces commuting and travel time. And I'll share with you guys a little bit, just some anecdotal evidence. We're currently surveying our clients right now to find out, what percentage of them are interested in going back in person, what do they prefer, all of that kind of thing. And what we're seeing is that, first of all, only 26% of our patients prefer in person to online. And actually, even if they prefer it, they're probably not, 26% are not likely to switch back to in-person because they don't want to drive more than 30 minutes. They're not interested in commuting to get treatment. And, reducing barriers, especially when we're looking at mental health treatment, is really, really important. It's clients with mood and anxiety disorders that have low functioning, clients with substance use disorders. Any barrier that we put in place, like a 45-minute commute after work, can actually discourage them and can be a factor in them stopping treatment and starting to pull away and not show up as much. And so reducing that commuting and travel time is really important, and actually kind of leads into the second one. It can actually increase adherence and participation. So if clients are able to balance getting treatment with the rest of their lives, they're much more likely to finish a program, to complete a program. And online really helps us do that. As I mentioned before, the outcomes are similar to in-person treatment when you're giving people the right level of care. And so that's quite important to know, and that is why I like to set the stage with that. But, a moderate client doing, intensive services in person or online is going to have similar outcomes. Some clients actually feel more able to disclose and open up from the comfort of their home. If you think about clients with anxiety disorders, the anxiety of commuting and traveling to a new building, finding the room, sitting in a room with a bunch of strangers, that can actually be quite prohibitive for them. And so there are some clients who are actually more willing to engage in treatment, they participate more in an online setting because it can reduce some of the anxiety. One of the other things that's true about online treatment is that there are a lot of opportunities for innovation and responsiveness to market demands. So, for example, if I'm running a clinic in a particular space and I see a need for a new program, if I don't, and this is quite operational, but it's true, if I don't have the physical space to open that program, that can be a real delay. With our online clinic, we're not limited by how much space we have or not being able to run 2 groups at once because the group room is taken. We can run multiple programs all at once, all over the place, different times. So what we've found is that with our online programs, we're able to be much more responsive to client needs, to market needs. We're able to create more programming based on what is that need right now, and we're able to launch it more quickly and get it out there. And then, of course, one of the other benefits of online treatment is that you're going to have a more diverse group composition. And this is actually something our clients in their feedback surveys actually indicate that they like. So we have clients from all over the country mixed in. Some of them are rural, some of them are urban, some of them might be on the East Coast, the West Coast, and they actually comment that they like to be able to connect with people from all over the country. So there are tons of benefits to online treatment, as I've just kind of outlined, but there are a lot of challenges too. And we've been doing online care since before the pandemic, but of course we've really increased how much we offer and what kind of programs we offer online since the pandemic. And we've learned a lot about addressing some of those challenges. And there are challenges. You have to think through some of these different things, and it's quite important. So you don't have a physical environment, right? A lot of our clinics, our offices are set up in such a way as to create a calm space, a comfortable space, a soothing space for clients. How do you do that in an online setting, right? And so, that is a challenge. And one of the things I'll say is that for us, we really work on training our staff on how to provide an online environment. What does that look like? How do you do that? And so we think a lot about how does this become a soothing, supportive space in an online setting? Because we can't use the physical environment to help us create that. You have to adjust your norms, your group therapy norms. So we have, any group program will have group norms, but ours encompass all kinds of things, including, what's your background look like? Are you muting? Are you not muting? Are you checking to make sure that you're in a private space? Can you join from your car? Probably not, unless it's an emergency. Should you use your phone, right? So there's a lot of different things that you have to think about, including what happens if somebody shows up to group intoxicated, and how do you deal with that in an online setting? And we'll get to that a little bit with risk and crisis, but you do have to adjust your therapy norms, and you really have to think about some of the things that come up that just would never come up in person. For example, are clients allowed to send each other private messages during group? We don't have that feature enabled. We've particularly disabled it, but those are all the things that you kind of have to think about. And that kind of comes to platform features. So, Zoom and all of the other platforms have quite a few different features. You have the chat, you have breakout rooms, you have whiteboards, you have all kinds of ways to do this. And you really need to think about using those effectively, not ineffectively. You have to think about, is this going to add therapeutic value? How am I going to supervise this? How am I going to manage this? And some of them really do add some great value and others don't. So you really have to think about which platform features you're going to use. Risk and crisis is very important. It's managed in a different way. If somebody shows up to group and discloses suicidal ideation, or that they are currently intoxicated, you don't have them right in front of you. And so you have to have different risk protocol. And we have that. We have specific staff who are our support counselors, are trained in risk management and crisis management, and how to do it remotely. How do we work with a client who has shown up to group, perhaps intoxicated? We've had to remove them from the online group, and then how are we going to support them and make sure that they're safe, make sure that we have everything around. So that's really important to think about. How are you going to deal with risk and crisis? And you certainly can do it, but you have to think about it, and that's something that we do. You're going to have to deal with IT issues. This is maybe something that people don't think about so much, but you're going to have to deal with IT issues, and you're going to have essentially IT support for these clients, especially if they have lower functioning or anxiety. Any issue with the technology can really prompt difficulties or can prompt a client not to show up to group. So we have a hybrid role, and we deal with risk and IT issues together. So we have a support counselor role where they're trained to both deal with support issues and to deal with risk, because if you think maybe you're dealing with an IT issue, sometimes you're also dealing with risk. Sometimes it's the other way around. Oftentimes those two things are kind of intertwined. And so we have to have somebody who's able to handle them both at the same time, because you don't quite know what you're getting when somebody calls in to say that they can't get into their meeting. I've already sort of touched on these, right? Clinical competence, really important that your staff know how to conduct therapy online. It's a different situation. And so we have specialized training for our staff in online treatment. How do you make sure that there's enough clinical support? How do you make sure that there's enough supervision and connection when you have a fully remote clinical staff? And we work really hard at that to make sure that our team is functioning as an interdisciplinary team and not individual therapists kind of doing their own thing from home. And of course, privacy and security, I'll talk about that a little bit more, but that's a really important part and some of the challenges of doing intensive programming online. Okay, group therapy. I'm gonna move a little more quickly because I want to leave time for questions. But I think there are definitely a lot of employers and other benefits providers out there that really think mostly about individual therapy, and we always like to talk a little bit about group therapy that essentially has a lot of benefits. And the research on group therapy really shows the benefits are in cost savings, right? So we have for both the client, if they're paying fee for service, or for an organization, because we're able to treat 12 clients at one time in a group setting. Groups have higher than normal completion rates. There are better outcomes, improved outcomes when people engage in group for anxiety, for substance use, for PTSD, depression, all of that kind of stuff. And, the great thing about group is that some of the gains made during the intensive portion are really maintained during the post-treatment period with group therapy. For clients, it can really reduce stigma. They're connecting with peers. They're with people in the same way, in the same situation. So it's really normalizing their experience. It gives them a chance to, work on their interpersonal skills and their interpersonal affective skills, which can be quite disrupted from their mental health disorder. And it can really combat isolation, right? That they're really feeling connected. And they can create an alliance with their peers in the group that can really lead to a supportive peer group post-treatment. So we have clients who are really staying in touch when they're finishing. They're really bonded with their peer group. And those are some of their main mental health supports when they finish treatment. All right, so I want to give you a quick look at our platform because, like I mentioned, we are facilitating these groups all online. We are treating at any given time. We have, between our intensive programs, our aftercare programs, we have anywhere from 1,000 to 1,200 clients in treatment at any given time. And those are all clients who are working online. And so we've developed our own in-house platform to do this. And we use three kind of separate areas. One, of course, is our video counseling capacity, really important. We're running, about 100-ish groups per week. And so that really has to work. Our patient mobile app, which I'll talk about. And then our clinical dashboard, where we organize everything, where we see how our clients are doing, monitor their progress, all of that kind of thing. So quickly, I will say, of course, really important with video counseling, you need to be privacy compliant. So we use the healthcare version of Zoom, which is different than the business version. It's HIPAA and PIPA compliant. And of course, both our groups and our individual sessions are facilitated through that. We also have a backup option, which is really important. We have Teams as our backup. So if Zoom was ever to go down, we can still manage our groups, right? And the other thing that I'll just quickly say about this is that everything has to be really easy for the client, as easy as it can be. And so all of our sessions are scheduled in the dashboard. We manage our calendar and our sessions and where clients are supposed to be the same way that we would if we were in person. So we know exactly what time everyone's supposed to be attending at and things like that. And for clients, it's really easy. They have a client portal that they can log into through our website. They can see all of their upcoming sessions 2 hours ahead of time. A button's going to show up so they can click to join, and they can download all of their homework, all of their materials. It's all there laid out for them. Their group norms, their program rules, all of that stuff is there for them in the portal. And of course, they're going to get all the email reminders, right? Remember, group starting in 2 hours, group starting in an hour. If the facilitator's sick and we have to change the facilitator, they're going to get a notification saying, okay, Rochelle's going to facilitate your group today instead of Jeremy. So it's really trying to keep the client as informed and as engaged as we can, make it easy for them. Our app, and I won't go into, like I said, everything because I do want to leave time for questions, but our app is really designed to help clients implement those skills and practice those skills in between the sessions. So everything in the app relates to what we're teaching in the program. So for example, if we're using, different CBT or DBT methods, we have a bunch of different ways, whether it's a video, whether it's an audio, whether it's a worksheet, whether it's a coping card or a meditation, that they can practice that content outside of sessions. So we really want them to be able to do that. There's also goal setting. So each client has a custom set of goals that we work on with them that are designed to support their recovery. There's a daily check-in. So they're answering a set of 5 to 10 questions each day. So they're tracking their mood, their symptoms, their use of learned skills. And each of that is different for each program they're in. So they're going to get a different daily check-in if they're in mood and anxiety versus substance use. And they're also able to view their progress. So there's a lot more features in the app that I could certainly talk about. And I have a couple of screens here to show you. But the idea is basically that what we're teaching them in group, we are helping them to put into practice in the app, and they have access to that app throughout the full year that they're with us, right? During the intensive portion as well as during the aftercare portion. A couple of screens of what our daily check-ins look like here. You can see, some emotions check-ins here in the mood and anxiety one in the middle. You can see some use of learned skills for our trauma clients. I'm really trying to help them connect the dots from the program. Here's a couple of more. Here's some of our tools and resources. So some custom video and audio, some worksheets and exercises here, and some coping cards, just to give you an idea of the different ways that it works. And as I mentioned, we have our clinical dashboard. So our clinical dashboard, a big part of it is administrative, right? All of the work that we have to do to keep all these 1,000 clients on track and where they're supposed to be, and knowing everything that's going on with them in terms of scheduling their sessions and all of that kind of stuff. But what it also allows us to do is monitor what they're inputting into the app. And we're able to get that real-time client data. So if they're logging their mood, if they're logging their goals, we're able to see the progress that we're making in the same way that they are, so that when we go into a session with them, we already have some background on how their day is gone, how their week is gone, which really helps us to customize those individual sessions. Okay, and finally, before we get to questions, I want to talk a little bit about outcome measurement. So this is a really important part of any clinical program, any therapeutic program that you choose, is of course outcome measurement. This is how we know, individually if clients are making progress, and as a whole, is the program actually making things better for clients. So we are administering outcomes at intake, and then in the middle of treatment, as well as at the end of treatment. We use a couple of different measures here. Essentially, we pair a symptom-specific measure. So for example, the LDQ, which is measuring dependence on substances, with the OQ45, which is really measuring their overall level of distress. Around things like anxiety and depression, around their relationships, their interpersonal relationships, and their social roles, so their job, their participation in family life. And so for each of our programs, the clients do this OQ45, which gives us that bigger picture of their life. And then it's paired with a symptom-specific measure to see how the symptoms of that particular disorder are improving, staying the same, increasing, whatever's happening. And I'd just like to share with you a little bit of some of our most recent outcomes from our substance use program. And what I have is outcomes on the substance use program, because right now that is our most popular. So we do have a good sample size from that. And so looking at 100 clients who completed the program, what we see is that clients see an average decrease of 66% on the Leeds Dependence Questionnaire. So what that means is that they're coming in with moderate substance use disorder, right, with symptoms that put them in that moderate category. And by the time they complete the 8 weeks, they now are in the low category. So a 66% decrease on that score. When we look at their overall life and that bigger measure that I talked about, what we see is that clients are coming into the program in moderately high distress. And they're in that moderately high category when they start. And by the end of the 8 weeks, they have decreased to that moderate distress by the end of the program. And we're starting to follow these scores into aftercare into that 10 months. And what we're seeing is that early data, we don't have a big enough sample size yet, sorry about that, to say, but we're seeing that scores are continuing to decrease into that aftercare portion of the program, which is really great to see. And finally, one of the things I like to point out too is that the OQ45, this overall measure, has a specific critical item score. So it's looking at things that are really high risk, things like suicidal ideation, aggression, particularly in the workplace, and self-harm. And what we see is that those high risk critical items are dropping by 54% on average for our clients. And so our outcome measures are showing us that currently with the measures that we have in the SUD program, the substance use program, the clients are getting real benefit from an intensive online outpatient program. And they are seeing big improvements and appropriate improvements, particularly considering that they're coming in at the appropriate level of severity, that moderate severity. Okay, so that is the end of my talk. We made it for time. I think Jeremy is going to open it for questions now.
Yes, absolutely. Perfect timing. And thank you so much for the insight. I know everyone's super appreciative of everything and lots of questions generated, which is always a great sign. So at the beginning, you were going through like ICBT and then CBT. So there's what is the difference between ICBT, LCBT, and then Ability CBT, and are all free for Ontario residents? I'm probably butchering those. I'm sorry. I work in marketing. I work in marketing, everyone. I'm not a clinician, so.
That's okay. I think the question is just around some of the different ICBT options that are out there right now. There are a few that are particularly government funded during the pandemic. I think Ability CBT and MindBeacon are both funded through the provincial government right now for residents of Ontario. The differences between them, they all sort of figure out how to translate what are CBT modules, a specific type of therapy, into a digital component. So, for example, from my knowledge, Ability CBT is app-based and goes through the different modules, and then MindBeacon is in an online setting, and then you have chat with your counselor. So they're all figuring out their way of translating CBT modules and CBT therapy into a digital setting, which I think is great and works really well for some of those low severity clients.
Perfect. Thank you so much. And then you kind of touched upon this anyways. There was a question about OHIP coverage. So that would be the government funding question that you mentioned before. So then what about those who do not have access to smartphones, the internet, or are tech illiterate? So examples would be low-income individuals or seniors hesitant to use technology.
Yeah, it's a great question. And the truth is that virtual therapy doesn't fix it for everybody, right? There are lots of Canadians that don't have access to high-speed internet, or they live in northern communities where high-speed internet is very expensive. And virtual therapy for them, it's not going to overcome some of those barriers. I think that it's a really great fit for a large percentage of the population, but it still is not a fix for some of those communities. And that's why we still need to offer in person, because it's not an option for everybody. And it's a good point, right? In terms of people who are maybe just hesitant to use it, what I would say is that one of the things that we do is we just offer our support counselors to do a walkthrough with them. So if they have high-speed internet, they have computers, that they have what they need from a socioeconomic perspective, and they're just nervous, we just offer trials. We walk them through it. We try and really support them and handhold them through it until they get used to it. And we find that really helps. So it's kind of a simple fix in that one particular case.
Yeah, I was just going to say with that kind of stuff, it's for sure just the scared kind of thing is because people just don't know, right? It's like the fear of the unknown. So if, like you said, we're able to walk them through a little bit better, it relieves that stress, right? Like in the potential anxieties of that. So
definitely.
A great thing to do for sure. So there's a question about how do you manage or navigate the no-shows for online treatment? So for example, when the number of people who register is significantly higher than the number who have actually show up.
Yeah, great question. So for our particular programs, because they are group-based, we are really we call everybody if they don't show up. So because our programs are quite structured and they're really meant for those moderate clients, so the intensity is higher. If a client doesn't show up to group, somebody's sending them an email afterwards, somebody's sending them, a message or giving them a call to find out what's going on. And the operational side of that, like that's the clinical side, is we have very clear policies and procedures around people showing up and what happens when they don't show up, and if they don't show up, how many times in a row, are they being discharged, what's going to happen. But in terms of the operational side, I would say that we've experimented a little bit in terms of what is the right group size to allow for a couple of no-shows and still have an appropriate group size. So there's a little bit of knowing your population, your specific population. If you work with a population where there's less accountability, like there is in our programs, you might open the group larger, knowing that maybe you're only going to have 50% attendance, because what you don't want to do is do too small of a group and then only have 2 people show up. So I think it really depends on your population. Yeah, that would be my answer for that one.
Awesome. Yeah, thank you. And then there's lots of questions about the referent process. So how would someone get referred to an IOP program?
Yeah, for sure. So great question. You don't need a diagnosis or a referral from a psychiatrist or a doctor to come into IOP. First of all, that barrier is off the table. You don't have to have that to get into an IOP program. For us specifically, if you are looking to refer, we have a team of corporate care specialists who work particularly with referrents. They'll get to know you, they'll talk to you, and I think, Jeremy, you can share the phone number to call or the email to get in touch with those corporate care specialists. But they will essentially get to know what your needs are as a referent and help guide you through that progress, sort of follow that client along and make sure that you have everything you need. And then I think the other part of the referral is knowing if moderate is the right program. Those corporate care specialists, as well as our admissions team, if somebody is paying out of pocket, are all going to do a screening to make sure that clients are moderate and that this is the right program for them. So they'll use some of those measures, the PHQ, the LDQ, to screen the client and make sure that they are fitting into that moderate category and that they're right for the program.
Absolutely. Thank you. Looks like we have time for one more question. So the question is more so focusing on provincial standards. So is this program only available for residents of Ontario? If so, is there something else similar for residents in other provinces?
Great question. No, this program is available to all Canadians. Because we're online, we're able to serve all kinds of clients, in all kinds of communities. And essentially, when you think about that kind of interprovincial support, our clinicians are registered social workers and they are registered psychotherapists. And so what we're doing is building staff that are kind of across the country and are registered in multiple different provinces. So if an employee is looking to use their health benefits to help pay for it or anything like that, that they can get a registered clinician that meets their needs. And so, that is how we are able to serve clients across the country.
Amazing. Thank you. Just to echo what everybody's saying in the chat, like informative, insightful, engaging. And I just want to say you give such a comforting vibe. It's just so conversational. It's so it's not intimidating at all, which is great. And I think a lot of people really appreciated that. So thank you so much for your time today. I know you're super busy. So
this is my favorite topic. So
yes,
I'm always happy to talk.
It's like your little brainchild, right? So it's great to speak about the different programming available. So yeah, thank you so much again, Rochelle, and thank you so much to everybody attending today. We will be sending out a follow-up email sometime mid to late next week with a copy of today's webinar recording, the slides that were presented, and additional resources, as well as a copy of your CEU certification. We hope to see you at future webinars. Thanks so much.